Hello, my name is Rachel with Guru Dental, and in this tutorial video I'm going to show you the layout settings in the Guru Teach software. To get to your settings, you need to click on this gear icon that is up here at the top left-hand side of your screen right here. Once you click on the gear icon, you're going to see this page. There are some options on the left-hand side. The one we will go over is the layout option, the layout settings. Once you click on layout, this is what you'll see. We have three options here. Now keep in mind that all of these settings are network wide, so any of these that you change will affect all of the computers that have Guru Teach installed on them across your network. The first thing that we come to is the color scheme for the software. You can choose from a few different options here. If you don't like the default of blue, then we have a couple other options. To see what it looks like, go ahead and click on the option you want. And if you like it, then just go ahead and click Save Changes at the bottom. That will give you a little preview. The next option is the presentation placement. What this is talking about is this presentation pane right here on the right hand side. If you would prefer, you can move it to the left over here or to the bottom down here. But currently it is set to the right, which is the default option. If you do make a change on the presentation placement, go ahead and make that change, and then just make sure and click Save Changes so that change is applied. The last option that we come to is in the layout settings is Always Save Histories right here, which is currently turned to off. So with it on off, what this means is if I want to save this presentation that I currently have in my presentation pane to the patient that I currently have opened, then I would actually go through the steps to save it to the patient by clicking on this End Consultation or File Folder top right icon, and it will bring me to this screen, and I would go to the patient history on this right grayed out side, and I would select the patient's name, and then I would go ahead and click Save. Then that would save that presentation to the patient's history. Now if we go back to that layout settings page and this Always Save Histories, if we turn it to on and make sure and save changes, if you do that, now when I hit the End Consultation, it's going to automatically save this presentation to the patient that I have opened without taking me to the other screen where I need to select the patient. So it does eliminate a couple of steps. See how when I click on the End Consultation, it automatically saved the presentation to the patient's history that I had opened. You can tell that it's saved because the patient name is gone, and so is the presentation. Now one thing you want to be careful of with this, when you do use the Always Save Histories, you want to make sure that you are saving the right presentation to the right patient. Because once you save that to the patient automatically, you cannot delete the presentation from the patient's history. You can only delete the patient altogether. So just make sure that if you use the feature that you are saving the correct information to the correct patient. And those are the three options available in the layout settings. I hope that this tutorial video has been helpful. Thanks so much for watching.